7:44, good morning to you. Does sleep deprivation cause ADHD? Well, Dr. Chaffoo joins us now with more on this new study that's out. Dr. Chaffoo, good morning, good to see you.
Good morning, good to see you too, Shally.
Is this study for everybody or does this address children?
You know, actually, the study is a fascinating study, Shally. What they did is, first of all, it was a study on adults. They looked at 104 people, 52 people with ADHD and 52 controls that didn't have ADHD, and they looked at the saliva samples, and what they found, interestingly enough, was those that had ADHD had a reduced rise in melatonin compared to people that don't have ADHD. And really what that means is melatonin is a very important hormone that urges or encourages one to sleep at night. It's a naturally occurring hormone. But in people with ADHD, they seem to have a diminished rise in that. And so what happens in people with ADHD, which commonly is seen, they tend to go to sleep later at night, and they don't sleep for as long a period of time. So the other interesting thing is that the other hormone that's involved in our sleep-wake cycle, or our biological clock, is something called dopamine. Dopamine is a neurotransmitter that's responsible for our wakefulness during the daytime. Again, they also found, these researchers, that in people with ADHD, the levels of dopamine were significantly reduced compared to people that do not have ADHD. So in a sense, the biological clock is impaired both during the daytime and at nighttime in people with ADHD.
Okay, what happens though with people with ADHD and how do you treat it?
Well, what happens, of course, the problem is inattentiveness, difficulty sleeping, carrying on tasks, working on school, job performance. And the treatment for it, the standard treatment has been a stimulant. The stimulant is essentially replaces the low level of dopamine in the brain, allows for wakefulness. And the important thing, of course, is that you want to try to do something to help people that are not getting enough sleep. So researchers have looked at things like light boxes, which we know seem to have an improved for people that have, are depressed or seasonal affective disorder. It may have a benefit in people with ADHD. The other common things to remember as a parent, if you have a kid with ADHD, is you want to make sure that you get your child to bed at a reasonable time, dim the lights, don't eat a heavy meal at night, and then put the electronic devices away from their bedroom at night, because when you have a screen on, again, it fools the brain into thinking it's the daytime, and plus people are still working, the mind is still working, and those two things can really affect people more significantly in ADHD to not get enough sleep and then not being attentive enough during the daytime.
Let's talk about a different study this week, breastfeeding and asthma. What does it say?
Well, it was a fascinating study that came out of the Journal of Pediatric Allergy and Immunology, and they looked at about 1,000 kids. And in that group, they looked at these kids that had asthma that were taking medications. And what they found, interestingly enough, in those kids that were breastfed, they actually had a lower incidence of exacerbations or serious uncontrollable asthmatic attacks than those that were not breastfed. And what the researchers theorized is breast milk, we know, has an effect upon the gut's immune system, in the sense it changes the flora and therefore changes the immune system. Asthma, we know, is immune related. And so the theory is that breastfeeding does seem to have some kind of a protective effect for people that are suffering from asthma, and that breastfeeding may have a beneficial effect for these kids.
And then how long do you need to breastfeed in order for this to be beneficial?
You know, nobody really knows now, and that's the next study that needs to be done. But certainly the longer you can imagine, the earlier you start, and the longer benefit it's going to have.
All right, Dr. Chaffoo, good to see you.
Good to see you.